So, on behalf of the PHACE syndrome community and for PHACE Awareness Week, I'm really pleased to welcome Dr. Denise Metry. She's a pediatric dermatologist in Houston, Texas, and has been passionate about children with infantile hemangiomas, particularly PHACE and lumbar syndrome, which is the topic of tonight's talk. And so I hope that you'll join me in welcoming Dr. Metry.
Thank you, Anna. Thanks everybody for being on. I was just telling Anna that this is a rare syndrome, and I am pretty sure no one's ever talked about this syndrome before in the PHACE community. So I don't know if you all who are on are lumbar parents or have lumbar or are PHACE parents, but regardless, I think learning about lumbar will also help us learn about PHACE because, as I'll show you, they're kind of sisters to each other. And so I just wanted to start kind of explaining about my background and how I got into this and have the privilege of speaking to you all tonight. So I've been in Houston. I've been practicing in Houston for over 20 years. I'm a pediatric dermatologist, like Anna said. And I did all my training here in Houston. And when I was a dermatology resident, I knew even by then that I wanted to be a pediatric dermatologist. So I was working with my mentor, who's a peds derm, in her clinic one day. And this sweet baby came in to see her. And her name's Victoria. She was 3 weeks old at the time. And her mother was so lovely and so worried, and she came in with a diagnosis of Sturge-Weber syndrome. And I knew enough to know that she didn't have Sturge-Weber, but I honestly didn't know what she had. So this was 1999, and there was very little out there about PHACE syndrome. So right after clinic, I went straight to the medical library. I spent hours looking up articles because back then you couldn't search the internet for PubMed and download anything. And I came across Dr. Frieden's article on PHACE, and that's when I figured out what she had. So from there, I took care of her throughout my residency and fellowship at University of Texas. And then I ended up seeing her, quite a bit over the years and reconnecting with her last year through the PHACE 10 and Up study, which was awesome that way because I could reconnect with families I hadn't seen in a long time. And she's 24. She's an adult. She has a job. She lives on her own. And so anyway, she's been a very special part of my life. And I've told her that she really changed the path of my career. So after that, I worked with Alona Frieden. I did a mentorship with her for a while. I've been part of the hemangioma investigator group for a long time. And that's how it started. And then I went from my training at University of Texas to be on faculty at Texas Children's Hospital. And so I've been interested in hemangiomas, and I've been interested in hemangioma syndromes for a long time. And the next thing that happened, which is kind of how I'm here talking about lumbar tonight, is another baby. So, our patients, as physicians, our patients often inspire us like Victoria did. And this baby, and I know that this picture is hard to look at and see, it's so hard for me too, but this baby really moved me as well. And he came in, he's probably the most severe baby with lumbar that I've ever seen. I've never seen anything like this with lumbar before this baby, and I've not seen anything like this since. But you can appreciate, his large hemangioma over his bottom and his leg. And he had a big, massive fatty tissue right here. And he had problems with the way his spinal cord developed. But most importantly, you can see his leg is completely abnormal, and it was connected to his buttock. This is a birth defect for unknown reasons. And this moved me so much because this poor child, the leg unfortunately was not going to be functional. So he ended up having a prosthesis made for him. And it's actually, he turned out to do so beautifully, like with this leg as it stands in this picture. He wouldn't have been able to be a normal little boy. He wouldn't have been able to run and jump and play. And with the prosthetic, he could, and he can. So he ended up doing really well, but there's, there's babies like this that really inspire us. Gosh, we need to learn more about this other hemangioma syndrome. So in 2010, this was a couple of years after I saw that baby boy, a group of us got together. We said, well, we'll put all of our babies with lumbar syndrome together and really study them, because no one at that point had put a big group of these babies together and looked at them. So we did this. We looked at all their different features. We came up with some imaging workup guidelines, and this was in 2010. And this is the paper that defined the LUMBAR acronym. And there's a couple of acronyms that were introduced for this same syndrome before lumbar, one called pelvis and one called sacral. But lumbar includes both pelvis and sacral and more, and has really become the most widely accepted acronym for what I'm going to be talking about tonight. So this is what it stands for. So these babies, so very similar to FACE, they have a hemangioma that's really different. So it's called segmental or pattern. So it's not, this nice round oval hemangioma. It tends to cover an area of skin in a pattern. So it's often extensive. It may occur just, in this area right above, right, the lower mid back. It may involve the entire buttocks and even extend down the whole leg to the foot. And you'll notice too, in lumbar syndrome, the hemangioma has kind of a unique appearance where it just doesn't grow very much. It might look kind of flat almost everywhere, but just grow a little tiny bit in certain spots like here. And we call that minimal or arrested growth, IH, infantile hemangioma, MEG for short. But despite this, really subtle appearance, one of the big skin problems in lumbar is that they can ulcerate really, really severely. So that's very different than FACE syndrome. And then along with the hemangioma, they tend to get problems with the way the anatomy developed regional, so in the same area as the hemangioma. So if it's over the buttock and genitalia areas, they may get problems with the way the genitals developed, or the kidneys, or the way the spinal cord developed, or the anus, or the bones may not have formed correctly in that location. So all of these things can occur in lumbar. And it can be really thought of as the lower body twin to FACE. And some of the similarities between those two syndromes are that both affect really otherwise healthy, full-term, normal birth weight babies. There's this regional correlation where you have the skin hemangioma, and then you have, changes in development of the anatomy in that same area of the hemangioma. In general, in both FACE and lumbar, the bigger the hemangioma, the more extensive it is, the greater the number of possible birth abnormalities can happen. But most babies, just like in FACE syndrome with lumbar syndrome, don't have everything in that acronym. They may have the hemangioma in one thing or two or three things, but very rare to have everything, just like in FACE syndrome. We don't know the cause of either FACE or lumbar, but I'm going to talk about a little bit of progress that's been made. And importantly, we have no evidence, y'all, that either are familial or inherited, either in FACE or lumbar. And then the other thing that really points to the fact that they're really sister syndromes of each other is that in the last couple of years, there have been 2 reports that describe babies who have both. They have features of FACE syndrome and they have features of lumbar syndrome, both. So that also speaks to the fact that they're really closely related. but they're not identical. So clearly the birth abnormalities that occur in lumbar are of the lower body, so completely different than face that affects the upper. Lumbar, we believe, is more rare than face. It's a little more common in boys. So in FACE syndrome, 80 to 90% of babies with FACE are girls, but in lumbar syndrome, about 1 out of 3 babies with lumbar are boys. So that's different. There are a few FACE babies who have been twins. Both twins have not been affected, but one twin, but that's not the case in lumbar. We have no reports in twins to date. The hemangioma in lumbar is a little different. As I mentioned, it has that appearance where it just kind of stays flat, doesn't grow much, ulcerates. And I believe that so in FACE syndrome, the most common thing we see besides the hemangioma is the problems with the way the arteries developed in the head and the neck and the heart. And I believe that the same is true for lumbar, but when I show you the incidence of that in all of the cases that we've looked at that have been published, it's very low, but that's because I think people haven't looked for artery anomalies. As you know, so to really see changes in arteries on imaging, you have to do very specific studies. So like, for example, an MR angiography that looks in very close detail at those vessels. And that really hasn't been done. So another area of study. Okay, so we've learned, we basically knew very little about lumbar up to a few years ago. And so I'll tell you a little bit about how the story of learning more really happened over the last couple of years. And it happened again because of patients and their families. And from a period, we had a very odd period from about, it's like right at the end of the pandemic, 2022 into about 2023, when we saw at Texas Children's 8 babies with lumbar in a row, which is very odd because, as I mentioned, it's a super rare syndrome. Some, dermatologists might see 1 or a few babies over the course of a year. So it was very odd. And around baby 6 or 7, one of my colleagues and I were consulting in the neonatal intensive care unit on one of these babies. And she was one of the authors on that lumbar acronym paper that I showed you. And her name's Yanela. And she said, Denise, we really need to establish diagnostic criteria for lumbar. And 100% I agreed, because establishing diagnostic criteria for a syndrome is really the first step in pursuing further research, because you really need a very clear group of patients, right, to make your data, your research more accurate. So that's really an important starting point. So we decided we were going to do this. And so I'm going to share with you a little bit of the process so I can tell you about what we learned. So the first thing we did is we just went through the literature, all the publications very thoroughly. And we looked up every, baby that had ever been born with a large hemangioma of the lower body and any other birth abnormality in that same location. And we came up with 144 babies and reports. And then we determined the frequency and the incidence of every single birth abnormality that we saw. And that led us to this kind of overall summary where all of them had the hemangioma, because that's how we were searching for these babies. And most of them had some sort of abnormality of the spinal cord. So that's the most common problem in lumbar syndrome besides the hemangioma. And then about a third of them had problems with their kidneys, with their genitals, of their anus or rectum. And about a fourth had other skin findings that I'll show you. And then a smaller number had changes in their bones in the same location as the hemangioma, or problems with their vessels. The vessel problems, as I mentioned before, are really probably an underestimation because most people didn't look for them. So Spinal cord abnormalities, I'll start with. This is the most common thing that you'll see in lumbar besides the hemangioma. And the typical appearance in lumbar when this is the situation is the hemangioma will be kind of in this location, anywhere from the mid of the lower back all the way down to the anus. So anywhere in that location. Sometimes, and this is true for this baby, there can be a mass of fat underneath the hemangioma. And what happens is the birthmark connects to the spinal cord, and we call that tethering. So normally your spinal cord is very flexible. It moves up and down. That's what allows you to jump on a trampoline and run and do all those things. And when it's tethered, when it's fixed, it's immobile. It won't move. And so with any effort, exercise like that, it will become damaged. It will tear. And so that can lead to problems like back pain, like weakness in the legs, like problems, peeing or pooping. So that can be a really important feature of lumbar that often needs to be surgically corrected, where they release that tethering, and so to allow the spinal cord to move normally. And then sometimes too, there can be in lumbar a cyst in the spinal cord, like a ball of fluid that doesn't connect to the skin, but can also cause very similar symptoms that I just mentioned. We see other skin findings in lumbar too, besides the hemangioma. So sometimes there will be that connects to the spinal cord, like a little hole that has a tract underneath that connects to the cord, causing tethering. There can be skin tags or skin growths that are unusual, and that often they contain muscle and fat and blood vessels and other unusual things. They're benign, but unusual. Sometimes babies will have what's called a pseudo tail. It's not a real tail. It doesn't have nerves. It can't move, but it looks similar. And all this finding and this finding and this here, it's a little scar that we call aplasia cutis. It's like very thin, almost like cigarette paper skin in the middle of the hemangioma, a skin defect. All of these things are very concerning for spinal cord problems and tethering of the spinal cord. And then another unusual skin finding I just want to show you, because there's two reasons. One, because this is a baby with PHACE syndrome, and sometimes PHACE is called PHACE. There's an S at the end, and that S stands for sternal problems. So where your chest bone either doesn't form properly, or there's a little hole or pit right in the middle, or there can be the other thing that the S of PHACES can mean is supraumbilical raphe. Okay, this is the scar, looks like a scar in a line that extends up from the belly button. And it's really a sign of when the baby's developing in utero, that the skin does not come together in the abdomen as it should, and it creates the scar. And it's interesting, just speaking of PHACE and lumbar being sister syndromes, that you can see the same thing in lumbar, except that the little scar extends underneath the belly button to the genitals. And so instead of a supra-umbilical raphe, or above the belly button, we call this infra-umbilical raphe. And I want you to remember this because in lumbar, one of the most serious presentations that we see, besides the baby that I showed you in the beginning, is when the skin actually doesn't come together into a scar like this, but stays completely open. And the organs underneath will actually come through the skin as a result. And that's, babies will still survive with that, but it does require serious surgical correction and can be a really devastating situation. So when I'm explaining this later, now you'll kind of hopefully can picture how that happens. And sometimes just talking about the anus or rectum, either the anus, so this is where the anus is blocked. This is an outpouching of anal tissue, or it's narrowed, or it's just not there at all. And sometimes there are fistulas. So you'll see like maybe a hole here or up here that's connected underneath, not to the spinal cord, but to the bowel or to the urinary tract system. So that's another thing that is seen in lumbar. Sometimes too, especially when the hemangioma covers the genital area, there can be differences in the way the genitals developed. And this used to be called ambiguous genitalia, meaning that sometimes the differences were so much that it was hard to tell in a newborn what the gender of the baby is. But now the term that's used for this is differences in sexual development. And those changes can be pretty minor, or they can be major. So this is an example of one of them that we see in lumbar called a bifid scrotum. And that means it's divided into two different parts here. Or you can just see in this baby girl that it just doesn't develop fully. So it becomes very difficult to tell the normal anatomy. And then, as I mentioned in the previous slide about how the skin sometimes doesn't come together under the belly button, sometimes there can be bladder exstrophy where the bladder actually protrudes through that skin defect. So that's another more rare problem that can happen in lumbar. There can be kidney problems, so where the kidney either doesn't develop on one side or it's in the wrong place, it's much lower than it should be in the abdomen, or the kidneys fuse together, which they shouldn't be, and this is called horseshoe kidney. And there can be problems with the bones that develop. So all these things tend to be in the same area as the hemangioma. So this is normal. So in this picture, you're seeing the end of your spinal cord. This is your coccyx or tailbone, and this is your sacrum, which is the bone just above that. And you can see in this baby with lumbar, those are completely absent. So the bones may not be there. They may be smaller than they should be, or they may just be abnormally formed. And then just going back to the arterial changes we can see. So sometimes, just like in PHACE syndrome, the arteries in the lower body extending, they can be abnormal anywhere from the buttock area down to the foot, are not there. They're small, they're narrowed. They may be bulged in an area or kind of pouching out. We call that an aneurysm. So very similar changes to what we see in PHACE, although again, only a few babies with arterial problems have been reported. So the next thing that we did to try to establish diagnostic criteria for lumbar, after we got all of that data that I just showed you together, is we recruited a number of pediatric subspecialists. So any specialist that had something to do with lumbar syndrome and those types of birth abnormalities. So urologists, kidney doctors, orthopedics or bone doctors, neurosurgeons, pediatric surgeons, and we got them all together, dermatologists too, and we wrote some initial diagnostic criteria. And then we had a group of 61 expert physicians, pediatricians in different specialties from all over the world, anonymously provide input on those criteria. And we did that by a survey. And after 2 rounds of kind of modifying those criteria, making them better, we came to consensus where everybody agreed that the diagnostic criteria would be useful to help diagnose babies with lumbar. So we just accomplished that. This has not been published yet. It's pretty simple. So to meet diagnostic criteria for lumbar, you just need the large segmental hemangioma and one other birth abnormality. We wanted to make it pretty, what we call sensitive. We wanted to make it inclusive because we know there's a lot more to learn, and we didn't want to make it so restrictive that we restricted patients or left patients out that really should be in. So we expect we'll be modifying this over time, just like we have for the PHACE syndrome criteria. But the neatest thing I think about this project is that it stimulated a lot more research around lumbar from so many other people. So we have all these projects now that are stemming from this one. And most of these are in progress or early in progress, but I'll just share a few of the highlights with you all so that you know what we're doing and working on. So one of the important questions that we have is when a new baby with a large segmental hemangioma of the lower body comes in to see their pediatrician or dermatologist, how do we evaluate that baby? What kind of imaging do we need to do? And this is a question that's really important. So the way we're going to look at this is prospectively, meaning that we're not going to look back at what we've done in the past, but we really need to do this study looking forward. So we're going to enroll new patients into this study and screen all of them for lumbar syndrome the same way to be able to answer this question. So the situation is that, as I mentioned, just like PHACE syndrome, the hemangioma and the birth abnormalities tend to be in the same location of the body, but it's not 100%. So, for example, all these babies that have hemangiomas, extending from the top of the gluteal cleft, the butt cleft, crease, crack, whatever you want to call it, down to the anus, are all at risk, we know, of having a problem with the way their spinal cord developed. But what we don't know is, these babies here, what's their risk of kidney problems? We don't know. What's their risk of having a problem with the way their bladder developed? We don't know the answer to that. And conversely, if you see a baby that has just a hemangioma in the genital or pelvic area, we know their risk of having a spinal cord problem is probably low, but we don't know the answer, because when you look back at the literature, most doctors just evaluated that one location. So this is an important question that we're going to be working on answering. We also don't know how to care. We know how to care for young children, but we don't know how they might fare as they get older. And as I mentioned, I loved that PHACE 10 and up study. The main way that was done was just developing, a group of families over time that we doctors are connected with, and we know we've been taking care of for a long time. And it's my hope that we'll be able to do the same thing with lumbar. And Dr. Siegel, Dawn, and I are really going to try to encourage families with lumbar to enroll in the registry. That's a really important first step to answer questions like this about what happens long term. So in the beginning, a dermatologist is probably the first doctor or specialist that your baby might see. And that's because we're the ones that are going to recognize the hemangioma, right? It's usually not there at birth, or it's pretty subtle. And then it grows a little, but it's unusual. So pediatric dermatologists are very capable of diagnosing the hemangioma and deciding, hey, this baby might be at risk for lumbar. And then we're usually the ones that will order the imaging needed. We'll also be the ones, once all those results come back, to coordinate all the doctors that your child will need. And then we are the ones also that will manage that hemangioma with propranolol or other treatment, and manage the ulceration. As I mentioned, ulceration in lumbar can be really severe. And then I just wanted to show this picture here. So even as children get older, and even though lumbar affects the lower part of the body and not the face, large hemangiomas that are segmental, even with medical treatment, can still leave some pretty significant changes behind to the skin. And that was discussed last night during the PHACE talk. But you'll appreciate in this little girl, she's older, but she had PHACE syndrome. And you'll see the same thing in lumbar, where you get these like broken blood vessel, this kind of persistent redness, these kind of these veins that are still very visible on the skin. Same thing can happen in lumbar. And if that's bothersome to the child as they get older, there are a number of laser techniques we can use to improve the appearance if they desire. Neurosurgery is really important, right? We talked about that, the tethering of the spinal cord. And if that's the situation, it will need to be released. Sometimes your child may need to see pediatric surgery to help correct, as I mentioned, if that skin did not come together in that lower, that pelvic area, that needs to be brought together. If there's problems with the way the genitals develop, that often needs to be corrected. So that's where those specialists come in. And then if there are significant changes in the bones or the way that the leg developed, orthopedics or the bone doctors can help with that. I think the most important, question that so many of us have been trying to answer is, why do these things happen? Why does lumbar happen? Why does face syndrome happen? And I wanted to share another thing that we've learned about lumbar in the past year, and it's that it doesn't just overlap with face syndrome, but it overlaps. So it overlaps with face syndrome in the sense that both face and lumbar, you have that hemangioma of the skin, and you have birth abnormalities that occur, in the same region as the hemangioma. You have blood vessel abnormalities. But there's another syndrome that affects the lower body that doesn't have the hemangioma generally, but otherwise overlaps very closely with lumbar. And it has, this acronym is OEIS. The omphalocele and exstrophy are things, very severe birth defects that happen when that midline skin doesn't fuse together. So omphalocele means that the abdomen protrudes out of the skin. And then we talked about this exstrophy, how the bladder extrudes from the skin. And then similar to lumbar as well, there can be where the anus is blocked, or there can be spinal abnormalities. And as part of those 8 babies that I explained that we saw over that short period of time, 2 of them had lumbar and OEIS. There's another one in Chicago, and then we found 6 more in the literature. So we reported that, and that publication just came out a couple of months ago. And again, this is important because, again, learning about one syndrome helps us learn about the other, and vice versa. So lumbar overlaps with OEIS as far as they have very similar birth abnormalities, and then it overlaps with face. So what is the connection between the 3? Lumbar overlaps with both. And what's the link between them? And so I also wanted to tell you, these, as I've learned, these birth abnormalities happen super early in pregnancy. So you can see that in the green, everything in green are birth abnormalities that happen in lumbar or the OEIS syndrome. And then the purple are face abnormalities, and then the blue can occur in either OEIS or face. And you can see the period of time that we think hemangiomas develop. And it really, everything happens from about week 3 of gestation up to week 9. So that's so early in gestation to explain all of these things. So now we're looking at, what's that? We're thinking that it's probably some combination potentially of environment plus genetics. So by environment, I mean, some of you may have heard that there's a clear relationship between skin hemangiomas and low blood oxygen in utero, hypoxia. So hemangioma tissue is an abnormal response to low blood oxygen. Low blood oxygen at an important point in early development in pregnancy can also lead to birth abnormalities as well. So is that part of the situation? We don't know why hypoxia happens. It may be different in different mothers, but that could be a part of this. And sometimes we see where a syndrome happens because of a combination of things. And that can include environment plus some sort of genetic susceptibility. So there's a gene mutation, a mutation in certain gene on top of that hypoxia, for example, that leads to that syndrome. And Dr. Siegel, Dawn, has been working on this so hard for a long time, but it's getting closer and closer and has some really exciting, actually, recent data that may be narrowing down where those gene mutations occur. But so far, we don't have a single gene identified yet. And then I'll just conclude by just talking about, families, how can families help? And very similar to with PHACE, as I mentioned, enrolling in so the PHACE registry is really the PHACE lumbar registry. And Dr. Siegel and I, and one of her medical students at Stanford, are going to be developing a lumbar specific form for families this summer. You can enroll in the registry now. We would love that. There's already a few lumbar families in the registry, but we would love to have more. So please consider that. This is the website you can use. And then the other really important thing is to consider genetic testing for your child and or for you or your child's biologic parent. So that's really important for the work that Dawn's doing. Lumbar has not been studied genetically at all to this point. So there's so much knowledge to be learned. So we would all appreciate, if we had that opportunity from any families to do that. She even just received a recent grant to help check for genetic changes in lumbar families. So the way to pursue that, if you're interested, is by contacting the PHACE registry at that same site. And then I would love to meet you all who are on the call. I don't know if any of you are part of this Facebook group. I wasn't even aware there was a lumbar Facebook group until relatively recently. And I think there's quite a few families that are part of this. And I know Maureen has been trying to reach out to this group as well. But if anybody has that connection, if there's anybody who would like to reach out to me directly from that group, I would love to meet more families. So please just let me know. So like I said, rare syndrome, very little known. We're really trying hard to make progress. So learning about one syndrome will help us learn more about PHACE and vice versa, and things like OEIS. And we're really grateful to be part of this PHACE syndrome community in general. And families, family relationships are one of the best things about being part of these organizations. So thank you so much. Happy to answer any questions. I may not be able to answer all of them because we don't know a lot, but I will try my best, and I will stop screen sharing.